Breast is a modified underscore gland. Sweat. Vertical extent of breast. 2nd to 6th rib in mid-clavicular line. Horizontal extent of breast. Lateral border of sternum to mid-axillary line along 4th rib. Muscles in relation to breasts. Pectoralis major below, external oblique on medial side. Serratus ant on lateral side. Order of muscles and fascia below breast. Pectoralis minor, pectoralis major, pectoralis fascia, retromammary space, fat, breast. Extension of breast from upper outer quadrant to axilla is called in the foramen through which it pass. Axillary tail of Spence, foramen of Langer. Areola contains modified underscore glands. Sebaceous. Location and nerve supply of nipple. 4th IC space, 4th IC nerve. Nipple is pierced by how many lactiferous ducts? 15 to 20. Internal structure of breast. 15 to 20 lobes, lobules, ducts lactiferous sinus lactiferous ducts nipple. Ligament of Cooper in breast extent and function. Its condensation of connective tissue, extend from skin to pectoral fascia. They support and shape of breast. Nerve supply of breast. 2nd to 6th intercostal nerve. Blood supply of breast. Internal thoracic artery, axillary artery, intercostal artery. Lymphatics drainage of breast. UL anterior nodes, LL posterior intercostal, internal mammary, LM subperitoneal. Histological layers of breast lobule gland. Outer to in, basement membrane, duct, myoepithelial layer, simple cuboidal, lumen eosinophilic. Normal histology of breast A. Fibrofatty glands plus stroma. Inflammatory lesion of beast's names. Acute mastitis, lymphocytic mastitis, granulomatous mastitis, peridicular mastitis, fat necrosis. Peridicular mastitis aka, causative factors in clinical. Zuska's disease or SMOLD, squamous metaplasia of lactiferous duct. Smoking, Vita deficiency risk factors. Squamous cells release keratin, so keratin plugging which cause abscess, fistula, sinus. Which inflammatory lesion of beasts occur during first month of lactation? Acute mastitis, Staph aureus. Which inflammatory lesion of beasts is autoimmune? Lymphocytic mastitis. Which inflammatory lesion of breasts can be caused by breast implants? Granulomatous mastitis. Pathological lesion of breast and their relative risk of converting to a carcinoma. Non-proliferative breast changes 3%. Proliferative disease without atypia -5–7%. Proliferative disease with atypia 13–17%. Carcinoma in situ 25–30%. Carcinoma in situ of breast mean. Atypical cells are limited by BM and myoepithelial layer is intact. Carcinoma in situ breasts types in which one is visible on mammography. 1. Ductal carcinoma in situ. 2. Lobular carcinoma in situ. Ductal carcinoma is visible on mammography as it produces calcifications, second one doesn't. Test to differentiate carcinoma in situ and invasive carcinoma of breast. 1. PA stain, it stains BM, in situ, it looks continuous and an invasive breaks in BM seen. 2. P63, it's a marker specific for myoepithelium, present in carcinoma in situ, absent in invasive. Types of ductal carcinoma in situ. 1. Comedo type with central area of necrosis. 2. Non-comedo type. Cribriform, solid, papillary, micropapillary. Paget's disease of breast features an important DD. Unilateral erythematous eruption of nipple plus pruritic. IMP-DD is eczema, it's bilateral. Paget's disease of breast indicates what? Indicates underlying malignancy. Here atypical malignant cells reach and destroy nipple areola complex via lactiferous duct. Appearance and stains for Paget's cells. Large cell, pale, vacuolated cytoplasm with paranuclear clearing due to glycogen and fat. They are Pa+, and diastase resistant, oil red O plus VA. Markers for Paget's disease of breast. HER2 NOI is plus VA. Overexpressed, PR VA. Types of breast tumors, classification. 1. Epithelial, ductal carcinoma in situ, invasive DC, lobular carcinoma in situ, invasive LC. 2. Stromal, fibroadenoma, phylloid tumor. Which breast tumor is aka breast mouse? Fibroadenoma, cause it's highly mobile. Gene mutation associated with fibroadenoma. MED12 gene mutation. FNAC pattern seen for fibroadenoma of breast. Staghorn pattern. Phylloid tumor histofeatures. Ducts compressed like slits in it. Breast grossly appear like a leaf. Risk factors for sporadic breast cancer. Early menarche, late menopause, high estrogen exposure, family history, nulliparity, no breastfeed, obesity and age, smoking. Risk factors for familial breast cancer. 1. BRCA1 gene. 2. BRCA2 gene. 3. P53 gene. 4. CHEK2 gene. Location of genes. BRCA1 gene. BRCA2 gene. P53, CHEK2 gene. BRCA1 gene CHR17. BRCA2 gene CHR13. P53 CHR17. CHEK2 gene. CHR22. What are the cancers associated with following genes mutations? BRCA1 gene breast, ovarian. BRCA2 gene male breast, prostate. P53 Li-Fraumeni syndrome. CHEK2 gene breast, thyroid. Which gene is associated with TNBC, triple-negative breast cancers most? BRCA1. Most common gene in sporadic breast cancer. TP53. Morphological classification of breast cancer. 1. IDCNOS, infiltrating ductal carcinoma, not otherwise specified. 2. IDC, special, lobular, mucinous, medullary, tubular, papillary. Specimen of breast for histopathology is stored in 10% neutral buffered formalin, fixative of choice. Sentinel lymph node biopsy is done in which cancers? 1. Vulval cancer. 2. Malignant melanoma. 3. Gastric cancer. 4. Breast cancer. What's the benefit of cryostat device, and WHT stain is used in it? To maintain low cryogenic temperature of sample. 1. To see the margins. 2. To know extent of spread. 3. To know lane status. Stain oil red O. Which is the most common type of morphological type of breast cancer? Not otherwise specified type. Gross and microscopic features of NOS type of breast cancer. Gross irregular, gray-white, gritty mass in upper outer quadrant. Microscopic, ducts lines by pleomorphic cells. Absent myoepithelium, tumor cells in stroma. Which scoring system is used to grade NOS type of invasive ductal carcinoma and WHT or its criteria? Bloom-Richardson score, TNM, tubule formulation %, nuclear pleomorphism %, mitosis. Which type of breast cancer is bilateral and multicentric? Lobular type of invasive carcinoma, special types. Pathology and gene in lobular type of invasive breast cancer. CDH1 gene mutation, so loss of E-caterin occur. What's the classical spread of lobular type of invasive carcinoma? To peritoneum and meninges carcinomatosis meningitis. What's Indian file pattern or single file pattern, and it's seen in which type of breast cancer? When cells are arranged after another. It's seen in lobular type of invasive breast cancer. Cells floating in pools of mucin is seen in which type of breast cancer? Mucinous type. Which type of breast cancer has fleshy gross appearance? Medullary type. Medullary type of breast cancer is associated with what gene mutation? BRCA1. What's peculiar feature of medullary type of breast carcinoma? Lymphoplasmacytic infiltrates and pushing borders. IHC markers for breast carcinoma. 1. Estrogen receptor. 2. PR progesterone receptor. 3. HER2/neu. And PR markers are responsive to, and side effect of it. Tamoxifen. SE endometrium hyperplasia. Good prognosis. HER2/neu marker is responsive to, and side effect of it. Herceptin trastuzumab. SE, cardiotoxic. Poor prognosis. Among PR and HER2/neu, which are membrane positive and which are nuclear positive? PR are nuclear positive, stains brown. HER2/neu is membrane positive. What's scoring system for PR positive? Allred score. The Allred score is a method used to assess estrogen receptor and progesterone receptor PR levels in breast cancer, particularly in immunohistochemistry IHC staining. What's scoring system for HER2/neu positive? If 0, +1, negative. If +2, do FISH analysis. If +3 positive, if FISH score more than 2.2 then positive. Prognostic markers for breast cancer. 1. Axillary lane status. 2. PR HER2/neu. 3. Size of tumor. 4. Stage of tumor. 5. Lymphovascular invasion. Most important prognostic markers for breast cancer, if no metastasis. Axillary lane status. Most important prognostic markers for breast cancer, if metastasis. PR HER2/neu. Molecular classification of breast cancer. It's based on gene expression profiling. 1. Luminal A. 2. Luminal B. 3. HER2/neu positive. 4. Triple negative. Most common molecular type of breast cancer. Luminal A. Proliferative index of following type of breast cancer. Luminal A. Luminal B. HER2/neu positive. Triple negative. Luminal A low. Luminal B low, high. HER2/neu positive, high. Triple negative high. Prognosis of following type of breast cancer. Luminal A. Luminal B. HER2/neu positive, triple negative. Luminal A, best. Luminal B good. HER2/neu positive core. Triple negative worst. Hormone status in following type of breast cancer. Luminal A. Luminal B. HER2/neu positive, triple negative. Luminal A PR plus, HER2. Luminal B all plus. HER2/neu plus PR, HER2 plus. Triple negative all.